We now are going to have our closing reflections from our co-chair of the Roundtable, Dr. George Isham.
So hello everybody. So I must correct Mary Lou one part. I think that the role of facilitation, and this is what I'm going to do, is facilitate reflections. And so it's not, I may give my own, as you know, I will give my own, interject my own views, but I think that the point of this last session is for us to take a look at this rich dialogue we've had over the course of the day and begin to reflect a little bit and offer up some of what we've learned. I have been very, very impressed with what we've heard today. So I'm going to be looking to all of the participants in the room to get into that reflective sort of frame of mind and to think about what we've learned in the context of our overall purpose. So the Institute of Medicine Roundtable, as my co-chair David Kindig laid out early this morning, has a vision of a strong, healthful, and productive society which cultivates human capital and equal opportunity. And that vision rests upon the recognition that outcomes such as improved life expectancy, quality of life, health for all are shaped by interdependent social, economic, environmental, genetic, behavioral, and healthcare factors, and will require robust national and community-based policies and dependable resources to achieve it. So it's that last phrase, robust national and community-based policies. And today we've been exploring the community aspect of, today and yesterday actually, the community aspect of this larger, robust sort of challenge of coming to an outcome of improved population for the nation as a whole, as well as for everyone in the nation in terms of the differences that we experience in our communities and which have been illustrated both in the site visit we saw yesterday as well as the conversation we've had over the course of today. So I'm going to want to ask you to reflect upon that. I want to, while you're doing that, I'm saying these things so you can do some reflection, because I want you to get you into a good frame of mind. I want to thank a couple of people. One, I want to thank Mary Lou for your leadership, both in the Planning Committee and today for this. I want to thank the Planning Committee itself, many of whom have served as moderators over the course of the day, but I want to thank those. And it's always a good idea to thank the people that really makes this run, which is the IOM staff, both Alina, Rose, Amy, Lila, who couldn't be with us because of illness today, Colin and Drew, and Amy, also all from the IOM who have made this happen. So one of the themes, and I'm going to just start off with one reflection of mine. One of the themes that I've been thinking about is how at the nation level we think about those things that have to happen in order to have the U.S. be a healthy country. And we think about public health, and I'm thinking about those 10 essential services, clean water and clean air and so forth, the fact that we'll be free of infection, those kinds of things, and how different those things are from what we've heard yesterday in the community and a lot of what we've talked about today that are of concern to specific communities. Not that it's an either or, but it's sort of a both and. And then the second thing with this last panel, as we got to institutions and the community, we began to look, to scratch the surface, I think, of a very good conversation around the relationship of institutions to this community work. So that interface between starting at the nation, if that's where you start and look downward, or starting at the community on your front porch and look upward, we haven't really sort of figured out how that works together and how the panoply of interventions need to be kind of knit together in a new quilt to sort of cover the task of making sure that we have a very robust health across the nation and in our communities for everyone. So to me it's a conflict in a sense, and I'm left as much with questions and about how that comes together. But so that's one thing I'm left with, is a series of questions about how all that works. And then, of course, to translate that into action, because we've heard a lot about the fact that we don't want to just study and know, but we want to do and act, how that can be translated into what the Roundtable can do, specifically with its kinds of things that it can do, but maybe even first, before we get to that, what we collectively as a society need to be doing to do better at the task of providing a healthier community. The thing that posed that a little bit was when Manuel Pastor started with his maps, his GIS maps, and he had the toxic environmental spots, and he was matching them up with communities that were deprived, and then he was looking at impact indices. And then we went to conversations about communities and activism and so forth. But he said in there, not every community that has that match of toxic and deprivation, I'm using my terms, I don't think he used those terms, has the active in community involvement that it needs to have. So what is the secret sauce that gets those things going where they need to get going, which gets the activities kind of get going? And so I think that begins also that transition from what happens in individual communities, activism, and how it moves to covering all the areas of need. It's sort of what has been a really predominant question over the course of the day, which is this scale and scope sort of issue that's come up in questions in almost every panel. How do you scale up? How do you scope? How is the scope broad enough to make a difference not only in one example, but across the community and so forth? So those are the questions I'm left with. I don't know if I had the answers out of this, but we've certainly gotten a lot of good insight. I can't remember a day that has been more thought-provoking for me personally than this day and yesterday afternoon. So I'll stop my talking there. I hope I've given you a chance to stimulate some of your own reflections, and I would ask you to come to the microphone and begin to make that so we can make sure that our folks on the web have the benefit of your insights and reflections as well. And my co-chair, David Kindig.
Sure. Well, actually,